Nag-screen rec na to. Wait lang.
Good evening, everyone. Good evening, class. So, kamusta kayo?
Kinakaya pa naman po, sir.
Ayun, mabuti naman. So, kasama nga pala natin si Doc Junel at Doc o Marius sa discussion na to. So, mag-hi naman kayo dyan, mga Doc.
Hi!
Ayun. So, sorry to meet you this late. Kasi work has been piling in the office, mga research, ganon. So, without further ado, let's start our discussion with a prayer. So let us all pray. Heavenly Father, we praise and glorify your holy name. We ask for your guidance, knowledge, and wisdom for our discussion today. We ask that you will help our students to internalize the lesson or the topic that we will be discussing today so that they could use it in their professional endeavors. This we ask in Jesus' name, amen. So, good evening once again, everyone. So, this discussion will be a continuation for our last topic in our phlebotomy class. So, before discussing going to the discussion proper, we have a short game entitled 4 Picks 1 Word. So, alam ko naman na that you are all familiar with this game na. So, for the information of everyone, we will be displaying 4 sets of pictures that depicts a certain word. So let's start. So first set of picture. So what do you think is the depicted word? Oh yes, Miss Zhyra.
Sir, capillary po.
Capillary. Let's check if Zhyra is correct. Yes, Zhyra is correct. So how about the other set? Oh yes, Miss Suzea?
Sir, puncture po.
Yes, puncture. Let's see. Yes, puncture is correct. So as you already know, our lesson for today would be capillary puncture, equipment, procedure, and blood typing. So, for our learning objectives, at the end of this discussion, the students should be able to explain the purpose of capillary puncture, to identify the equipment used for capillary puncture, to perform the procedure for capillary puncture, to differentiate the differences between different blood types, and then to evaluate the risk associated with capillary puncture, and of course, to create a plan to ensure the safety during capillary puncture procedure. So, I will be showing you a video. So watch carefully. This would serve as the introductory part of our lesson.
Blood gas sample collection and proper handling. This is an instructional video about how to collect a capillary blood gas sample. Follow your local hospital procedures to prepare the patient and collection site for obtaining the blood sample. Collecting arterialized capillary blood may be an alternative to arterial blood collection, particularly in infants. The most typical site for capillary collection in infants is the lateral or medial plantar surface of the heel. However, the tip of the big toe, fingers, and earlobe may also be used. Blood gas analysis is performed to test vitals in critically ill patients. Blood gas analysis gives information on gases and may also include electrolytes, metabolites, total hemoglobin, co-oximetry, and neonatal bilirubin. In theory, blood gas values obtained from a capillary draw approximate arterial values. However, typically the PO2 values obtained with capillary samples may be lower. Please ensure you have all the materials you need to draw a patient sample. This includes a capillary tube, the capillary caps, a lancet, an alcohol wipe, gauze, and bandage. The capillary used for blood gas analysis should include dry, electrolyte-balanced lithium heparin as the preferred anticoagulant. Before performing the capillary draw, confirm the patient's identity. To arterialize the puncture site, warm the skin to a temperature of approximately 42 degrees Celsius. Clean the puncture site. Do not use a skin cleaning wipe that contains quaternary ammonium substance, such as benzalkonium, as it may affect the electrolyte parameters reported, particularly sodium. Let it dry. Puncture the skin with a disposable lancet to a depth no greater than 2.0 millimeters. Wipe away the first droplet of blood. Place the tip of the capillary sampling device in the center of the blood droplet and allow to fill the capillary as rapidly as possible without air bubbles. Fill the capillary tube completely with blood that contains no air bubbles. Seal both ends of the capillary with the capillary caps. Apply pressure to the collection site and bandage the heel. Mix the sample thoroughly by rotating your wrist back and forth for a minimum of 20 seconds. This helps to dissolve the heparin and minimize clot formation in the capillary. Label the capillary with the patient ID and immediately transport the capillary to a Siemens Healthineers blood gas system. Follow a two-step mixing process, first by rotating your wrist back and forth, and then rolling the capillary between your fingers about 10 times. Remove the caps from the capillary. Do not expel any blood onto a gauze pad to ensure sufficient sample volume for analysis. Present the capillary sample to the analyzer and start analysis. Recognize that a sample containing blood clots should not be used on the blood gas analyzer because it can affect not only the accuracy of the patient results, but also negatively impact the operation of the blood gas analyzer. The patient's blood gas results will be ready within 60 seconds. According to the CLSI guidelines, blood gas testing should be completed within 10 minutes and not longer than 30 minutes after drawing the sample. Remove the capillary from the analyzer and discard the capillary according to hospital guidelines. Proper sample handling, mixing, and time to analysis helps to ensure accurate patient results.
Okay, I hope you have watched the video carefully para may magamit kayo in the course of our discussion. So, first would be, let us define what is capillary puncture. So, capillary puncture, or also known as skin or dermal puncture, is a technique of choice to obtain blood specimen from newborns and pediatric patients. However, this can be also used on adults provided that the skins of these adults are severely burned. Their veins are reserved for therapeutic monitoring. They are extremely obese, or that the patients, elderly patients with fragile veins. So take note that this is a choice for taking blood samples from newborns. So what is the composition of the blood collected during the capillary puncture? So the blood obtained from capillary puncture is a mixture of blood from venules, arterioles, capillaries, interstitial fluid. These are the tissue fluid from spaces between cells, and intracellular fluid, or the fluid between or within the cell. So the specimen resembles arterial blood more closely after warming the puncture site. So dahil dito, in order to avoid slightly different test results, the phlebotomist should indicate the specimen that was obtained through the skin puncture. So you should also take note that venous blood glucose is 7 milligram per deciliter lower than in capillary and arterial arterial blood. And also, capillary blood glucose is 1.4% higher than in venous blood. So, electrolytes just like potassium and also total protein and calcium are decreased in capillary puncture. Wherein that potassium is 0.9% higher in venous blood. We also have phosphorus and urea in venous blood, which have no significant difference. However, for analytes, just like bilirubin, calcium chloride, sodium, and total protein, they are lower in capillary blood than in venous blood. So, for example, in bilirubin, it is 5% lower, while calcium, 4.6 lower, and then chloride, it is lower by 1.8%, and then sodium, 2.3% lower than. For total protein, it is lower by 3.3%. It should be also further noted that in capillary or dermal puncture blood, there is a decrease in RBC count, hematocrit count, and also hemoglobin and platelet count. However, there is an increase in white blood cell count, or that's our neutrophils. So there will be a tissue damage as a result of the puncture, which is why it is crucial to specify on the requisition form that the method of blood collection is capillary puncture. Oh yes, before we move on with the capillary puncture with Doc Marius to tackle that, may I ask Zhyra again, what is the composition of the blood that is collected in capillary puncture?
Sir, the blood from capillary puncture is composed of a mixture of blood from venules, arterioles, capillaries, interstitial fluid, and intracellular fluid, sir.
Okay, that's right. Thank you for listening, Zhyra. Okay, let's move on to capillary puncture and procedure. Doc Marius, take it away.
Ayan, so hello everyone. I am Professor Marius. So can you please go back one slide? Ayan, so we will now discuss about capillary puncture procedure. So there are two main ways in administering capillary puncture. So first is through a finger stick procedure, and second is through a heel stick procedure. So ano bang pagkakaiba nila? So finger stick procedure, as the name suggests, ang kinukuhanan natin or ang pinapuncture natin na area is around finger stick. Okay? And sa heel stick naman is, of course, ang kinukuhanan natin na area is the heel of the foot. Okay? So another differences nila is sa finger stick procedure naman, ang kinukuhanan natin ng patient is usually patients who are 1 year older and above. And also, so of course, these are your own adults and babies or infants who are 1 year older. And sa heel stick naman, ang kinukuhanan naman natin na patients dito is infants or newborns na 1 year below. Yes, so these are your newborn infants. Okay, so next slide. Okay, so capillary puncture is a method of choice for drawing blood from newborns and young children under the age of 2. For the following reasons, it can be difficult to locate superficial veins in these patients that are big enough to take even a small gauge needle, and available veins might need to be reserved for intravenous therapy or therapeutic monitoring. Use of deep veins such as the femoral vein can be dangerous and may cause complications such as cardiac arrest, venous thrombosis, hemorrhage, and reflex arteriospasm. And anemia can be quickly brought on by taking excessive amounts of blood from premature and small infants. So the thing with infants kasi guys is that they are very sensitive with medical interventions. Okay? So one of the reasons actually kung bakit heel stick ang ginagamit natin sa mga infants is that because they have very hindi pa ganun ka-form yung bones nila. So yung bones nila is very brittle. So kapag kumamit tayo ng finger prick, is tendency is nagkakos tayo or may chance na mag-cause tayo ng serious bone injury. So Similarly, anemia can be quickly brought on by taking excessive amounts of blood from premature and small infants. So as what I said before, very sensitive ang infants sa medical intervention. So some specific tests require capillary blood such as blood gases. Next slide, please. Yan. So capillary puncture is a method of choice for drawing blood from adult patients for the following reasons. First is apprehensive patients. So ito yung mga patients natin na mga takot sa mga syringe, ganun, takot matusok. And burned or scarred patients, geriatric or other patients with very fragile veins. Guys, kapag kasi matatanda na, is very madaling pumutok yung veins nila kapag kinukuha na natin ng dugo. Another patients is obese patients, so mahirap sila kuhanan or mahirap hanapan ng vein. Patients receiving chemotherapy who require frequent tests, patients with thrombotic tendencies, patients with inaccessible veins, and patients requiring home glucose monitoring and point-of-care tests. So note that it is not possible to obtain satisfactory sample from patients first who are dehydrated, who have poor peripheral circulation, and those who have swollen fingers. Next slide.
So, good day, everyone. I am Professor Junel Corpuz, and I will be discussing the capillary puncture equipment. So, before I start my discussion, maitatanong muna ako. So, class, do you have any idea about the different equipment being utilized in performing a capillary puncture?
Yes, ma'am.
Can you give an example, Ms. Zhyra?
Dun po sa pinanood kanina na video po is lancets po.
Yes. How about Suzea? Meron ka bang idea sa isang equipment na ginagamit natin for capillary puncture? Oh, I think naglalag ang si Miss Suzea. So, now let us proceed na sa ating discussion.
Ma'am, YouTube po.
Oh, okay, everyone. Good job. So now we will start na with our discussion. So before ko i-start yung discussion natin, kailangan nating malaman na before tayo mag-conduct ng capillary puncture, dapat kumpleto muna lahat ng equipment. So ano nga ba yung mga equipment na dapat nating i-prepare? So first is the capillary puncture devices or what we call the lancets. So ano ang lancets? Ang lancets, these are called your incision devices, which is yung ginagamit mo para i-prick or para mag-cut doon sa heel or sa finger kung saan mo kukuhanan ng capillary blood yung isang patient. So they are specifically designed to be used for finger or heel puncture. So both types of devices are required to have the OSHA safety features. Ano nga ba ang OSHA? OSHA is your Occupational Safety and Health Administration. So this includes the use of retractable blade or needle to reduce the risk of sharp injury. Sa lancet kasi, pwede yung tayo mismo yung magpiprick or meron tayong device na i-click mo lang siya then magre-retract na mismo yung blade. So, according to the Clinical Laboratory and Standards Institute, it recommends that the incision depth should not exceed 2.0 millimeters in a device used to perform heel sticks. So, bakit kailangan 2 millimeters lang siya? Kailangan 2 millimeters lang siya para ma-prevent natin ang mga bone injury or also called your osteomyelitis. Since especially ginagamit ang capillary puncture sa mga babies, sa mga infants, dapat not more than 2 millimeters yung depth ng puncture natin. So ano yung length of lancet is 1.75 millimeters. Then the depth of incision for infants should be 2 millimeters, while the depth of incision for adults should be 2.5 millimeters. So take note that the distance from the skin surface to bone in the middle finger. So note that to obtain a sufficient blood flow, then 5 millimeters. So next, bukod sa lancet, ano pang kailangan natin? Next are the capillary tubes or what we call the microhemat tubes are specifically designed. small plastic tubes used to collect minute volumes of blood via capillary puncture. So they are coated with different additives and color-coded to represent the additive, just like the regular collection tubes. So some also have markings indicating the volume in microliter, and some fitted with capillary tubes or scoops to help with specimen collection. So, ano yung itsura ng mga microhematocrit tubes? Yung nakikita nyo dyan sa PPT, microhematocrit tubes are glass or plastic capillary tubes used for blood collection and hematocrit determination. So, meron tayong, yung mga microhematocrit tubes na yan, may mga anticoagulants sa loob. So, these are tiny tubes used to draw 50 to 75 liters of blood, primarily for the purpose of a microhematocrit or packed cell volume or our PVC test. So they are designed to fit into a hematocrit centrifuge and its corresponding hematocrit reader. So di ba nabanggit ko na may two types siya and may color coding sila. So first, next slide please. So we have the red band or the heparinized tube. Ayan, nakikita niyo yung red band sa dulo, meron siyang red band. So anong use ng ating red band or heparinized tube? So this is used for hematocrits collected by dermal puncture. So a capillary tube with a red band, which are tubes coated with anticoagulant heparin, are used to prevent the clotting of the blood during recollection of capillary blood samples. So our red band are heparinized dahil yung anticoagulant sa loob ng glass is heparin, which prevents clotting of the blood. Then next, we also have the blue band. Next, please. We also have the blue band or the plain tube, so which is used when the test is being performed on blood from a lavender stopper ethylene diamine tetraacetic acid tube. So, ang size nito is 7 to 7.5 millimeters, while yung bore nga is 1 millimeter or 1.2 millimeters. Then, our clay sealant niya is up to 4.6 millimeters only. So, itong mga tubes na ito, yung mga microhematocrit tubes, pwede silang ma-centrifuge up to 15 minutes. So, next is our micro collection tubes. So we have your lancets, we have your microhematocrit tubes, then next we have also your micro collection tubes. So these are also referred to as microtainer or plastic tubes that offer a great volume of collection and pose no risk from broken glass. So these are designed to hold 600 liters of blood, and blood splatter and leakage are prevented by using BD microtainer tubes with BD microguard closures. So these are small plastic beads present in identical collection tube systems, facilitate mixing of anticoagulated samples. So ang pinagkaiba ng microhematocrit sa microcollection, microhematocrit, usually ginagamit siya kapag small amount of blood lang ang kailangang i-collect. While your microcollection, ito yung ginagamit kapag more amount of blood ang kailangan for testing. So ano pa yung ibang equipment bukod sa lancet, microhematocrit, and microcollection tubes? So we also have, ito yung mga additional equipment. First is of course your glass slides. So yung glass slides, ito ginagamit siya, kunyari after ma-collect, magkakonduct ka na ng blood typing. So yun yung purpose ng glass slide. So during the dermal puncture, blood smears for the examination of RBC morphology in the white blood cell differential may be made and require a stock of glass slides. Then next, we also have your alcohol pads. So syempre, before tayo magkakandak ng capillary puncture, kailangan ng disinfection. Yan ang importante bago tayo mag-create ng incision. So the product used most often to cleanse and disinfect the site prior to venipuncture is 70% isopropyl alcohol in towelette form. Then next, we also have the gauze. So the gauze pad is usually used by the phlebotomist to apply pressure to the puncture site, and it maintains sterilization. It is important to use pressure on the area because it helps the bleeding to stop and begins the blood clotting process. So itong gauze, di ba, after ma-collect yung blood, syempre, to stop the area, to stop it from bleeding, kailangan mong may ilalagay ka doon. And yun yung purpose ng gauze. Okay? So always remember that povidone iodine or betadine should not be used because it may contaminate the sample and increase bilirubin, uric acid, phosphorus, and potassium. So para madali mo itong matandaan, meron tayong acronym dito which is BURP with double P. So bilirubin, B, uric acid U, phosphorus P, and potassium P, another P. So lastly is the sharp containers. So taas may tanong ako, bakit kailangan natin ng sharp containers, hindi yung normal lang na mga bins sa hospital, ganon? Anyone? Miss Zhyra, do you have any idea kung bakit kailangan na sharp containers?
Kasi po, ang sharp containers, ma'am, is meron siyang specific symbol or color yung container na yun. And yung container na yun, dun nilalagay yung mga needles na ginamit to avoid certain injuries po.
Okay, very good. So itong mga sharp containers is a safety consideration to prevent the possibility of any needle stick injuries. Para to sa mga nangongolekta rin ng basurahan, syempre para ma-prevent na ma-prick sila and makakakos pa to ng disease or yung transmission of disease. Okay? So the phlebotomist must ensure that there is a conveniently located sharps container for the disposal of any needles, syringes, and lancets. Okay? So now that you know the different equipment, Professor Marius will now discuss the capillary puncture site. So please listen attentively.
Okay, so next topic is the capillary puncture sites. So these are the sites kung saan tayo nagpe-pick or nagpa-puncture. So for infants under 1 year of age, the area is the lateral, outside, or medial inside plantar bottom surface of the heel. Meanwhile, kapag children older than 1 year of age naman and in adults, it is the palmar surface of the distal portion of the third needle or fourth ring finger on the non-dominant hand to be used. So guys, kapag nagpipick tayo or nagpa-puncture, we have to be reminded na yung direction ng pag-puncture natin is dapat perpendicular sa fingerprints or the fingerprint lines. And I think that's it. Next slide.
So thank you, Prof. Marius. Now let us proceed to the precautions with capillary puncture. So before tayo ulit mag-conduct ng capillary puncture, of course, after preparing your equipment, dapat alam mo din kung ano yung mga precautions that come with capillary puncture. So first ensure that the finger or heel is safely immobilized. Infant's heel should not be punctured more than 2 millimeters deep due to the possibility of causing bone damage and infection. Nasabi ko na kanina yan that it should not exceed 2 millimeters kasi pwede siya mag-cause ng bone injury or what we call osteomyelitis. Next is a puncture tool that creates an even smaller incision is preferred when treating premature infants. Yun nga, mas maganda na mas maliit yung incision para ma-avoid ang osteomyelitis. Next, an area that is swollen, bruised, infected, or has already been punctured should not be punctured by the phlebotomist. Phlebotomists should also avoid performing skin punctures on patients who have edema, dehydration, or poor peripheral circulation because these conditions could compromise the integrity of the specimen and accuracy of the test. So ito, yung mga bawal kapag magpa-puncture site tayo. Siyempre, kailangan mo itong i-take note kasi pwedeng mahirapan ka sa pagkuha or second, pwedeng maapektuhan ito yung results na makukuha mo. Then next is the first drop of blood should be wiped away with a clean gauze pad to prevent contamination of the specimen with tissue fluid and to facilitate the free flow of blood. And that is all the precautions with capillary puncture. So before we proceed to our next topic, may game muna tayo. And this game is what we call where to prick. So, paano nga ba ang mechanics ng game na ito? So, ang gagawin lang, magbibigay kami ng cases, then ang gagawin nyo lang is provide kung saan dapat ipiprick, saan yung puncture site. Okay? So first, a patient who is 5 months old and has been severely burned. So where to prick? Anyone? Okay, Miss Suzea?
Ma'am, heel prick po.
Okay, let's see if Miss Suzea is correct. Very good. Now, our next case. What is the recommended site for finger puncture in adults? Anyone? Okay, Miss Zhyra?
Distal segment of the middle finger po.
Okay, let's see if Miss Zhyra is correct. Very good. Then last, a patient older than 6 months and weighing more than 10 kilograms. So where to prick?
Ma'am,
Okay, Miss Nicole?
ma'am, finger prick po, ma'am.
Let's see. Very good. So wow, halatang nakinig ang lahat ah. Now, let us proceed to our next topic naman, which is the order of draw. So itong order of draw, tulad nung kung ano yung tawag sa kanya, order of draw, ito yung susundan mo sa pag-collect ng tube, sa pag-collect ng blood, I mean. So first is tube for blood gas analysis. Itong order of draw, dapat ma-follow mo siya, hindi pwede na kung ano-ano lang yung arrangement ng pag-draw mo ng blood. Okay? So first is tube for blood gas analysis. Then second is slide, unless made from specimen in the EDTA microcollection tube. Then third is EDTA microcollection tube. Then fourth is other microcollection tubes with anticoagulants. And fifth is serum microcollection tubes. So ang gagawin nyo lang dyan, guys, is you need to familiarize yourselves with the order of draw since yan na mismo yung order talaga, hindi yan naiiba. Okay? So, with that, meron tayo another game. Another game regarding the order of draw. So, ayan. So, let's start. Who wants to... Ang gagawin nyo lang dyan is you need to pick 2 cards. And dapat, ang na-pick yung card is number 3. So, dapat ang next na ma-pick na card is yung third order of draw, which is the EDTA microcollection tube. So, who wants to go first? Miss Diane, can you pick 2 cards, please?
Ma'am, 9 and 5 po.
9 and 5. Let's see kung nagmamatch ba sila. Oh, no. Next round. Miss Zhyra, please.
Ma'am, 2 and 4.
2 and 4. Let's see the card number 2 and 4. Oh no! Next, please. Miss Nicole.
Ma'am, 8 and 6.
8 and 6. Oh no. Let's see, Miss Suzea, how about you?
Ma'am, 1 and 8.
1 and 8. Oh no. Miss Diane, can you give another pair of cards?
Ma'am, ang hirap naman po. Pwede po, meron po bang, paano po yung probability dyan? As in, isang bahan lang po ba na mahulaan namin?
Since napakita kanina yung cards, di ba? Nung nag-start tayo nung game.
So dapat i-take note po.
Yes. Okay. Para mas madali, i-refresh natin yung website.
Okay po.
Ayan. Refresh.
Prof.
Okay.
Junel, ako makisali dyan.
Pwede kayo magkisali mga dok. Ayan. Memorize. Did you see na? Another?
Sige po, maghula po ulit. 3 and 4 po.
3 and 4. What's under 3 and 4? Nothing. There, oh. Okay. Since medyo nahihirapan na po tayo, let us proceed na lang muna sa ating next topic, okay? So, Mr. Marius, Doc Marius, ikaw na po ang bahala.
Ayan, so andito na tayo sa finger stick and heel stick procedure. So ito na yung mismong procedure sa pag-administer natin ng capillary puncture. So first is to review the accession test request. So guys, before kasi tayo mag-undergo or before tayo mag-administer ng capillary puncture, first kailangan muna natin ng request from other healthcare professionals. Okay? Next is to approach, identify, and prepare patient. So guys, ito isa to sa pinaka-importanteng step sa procedure natin because kailangan kung sino yung ni-request na patient, dapat siya yung makukuhanan, okay? Kasi guys, madami kasing cases na kunwari kinuhanan siya tapos iba pala yung dapat kukuhanan. Ganun. So, ikaw yung dehado niyan kapag ikaw yung intern, ganun. So next is verify diet restrictions and latex sensitivity. So guys, latex sensitivity is what type of reaction? What type of allergic reaction based on our past lessons? Can anyone answer?
Type 2 and 4, sir.
Ayun, tama si Germaine. So it is a type 2 and type 4 latex sensitivity reaction. Next step is to sanitize hands and put on gloves. So of course, kailangan safety pa rin ng ating patient and also of yours. Next is position the patient. Select the puncture or incision site. So of course, kapag older than 1 year old is kailangan sa finger, or kapag under 1 year old is magpipig tayo sa heel. Warm the site if applicable. Clean and air dry the site. So guys, important na air dry natin yung alcohol natin kapag mag-apply tayo ng alcohol, guys. Kasi kapag i-prick natin and then hindi pa tuyo, guys, mahapli yan sa mga patients natin. So syempre, as a healthcare professional, dapat at most importance pa rin yung comfort ng ating patient. Okay, may parang technical difficulties. Ayan, so step 9 is prepare the equipment. So yung mga kailangan natin, na-discuss kanina ni Professor Junel. I'm sorry. Step 10 is to puncture the site and discard the lancet or incision device. Next slide, please. Wipe away the first blood drop. So guys, may tanong ako, bakit kailangan natin wipe away yung first blood drop? Anyone?
Sir, kasi it's possible po na contaminated po ng tissue fluid yung makontaminate ng tissue fluid yung specimen po.
Yes, so tama si Nicole. So aside from that, may possibility kasi na yung ethyl alcohol natin kanina is ma-contaminate yung drop of blood natin. So as much as possible, kailangan mina-wipe away natin yung first drop of blood. And yung kinukuhanan natin is yung consequent na drop of blood. So next step is to fill and mix the tubes or containers in the order of draw. Next is to place gauze and apply pressure. Guys, pinaka-important yan. Guys, nakakalimutan kasi natin na mag-apply ng pressure. So why do we apply pressure? Kailangan natin mag-apply ng pressure para ma-initiate yung clotting process. Okay? So again, huwag kakalimutan, apply pressure. Next is to label the specimen and observe special handling instructions. So guys, again, important ang ating label, ang specimen label. Next is to check the site and apply bandage and diagnose used and contaminated materials. Dispose used and contaminated materials, of course, to their designated container or bins. Next is to thank the patient, remove gloves and sanitize hands. And lastly is to transport the specimen to the lab. Next slide.
So ayun. So now that you have learned the procedure per se for capillary puncture, we will now discuss the requirements for quality specimen. So ano nga ba yung mga requirements para magkaroon tayo ng quality specimen, which is yung blood na kino-collect natin? So for the first requirement, that would be patient is properly identified. So we have discussed earlier sa procedure, di ba? First and foremost is the patient identification. So why natin yung ina-ensure is that um, para hindi magkaroon ng confusion when it comes to sinong nagmamay-ari nung specimen. So baka yung specimen na yun is mapunta sa other patient which is dun palang mali na. So next requirement would be that the patient is properly prepared for draw. So the patient should be in a correct position for vein puncture. In our case, capillary puncture. So this might involve having our patient lie or sit or lay down and providing an armrest or pillow to make them comfortable. So the patient should be also instructed to take deep breaths and keep their arms still during the procedure. So dito, kailangan na physically ready din ang ating patient. Because some of our patient, kapag na-expose sila sa mga ganitong procedure, then makakita ng dugo, some of them will feel dizzy and then suddenly faint, di ba? So next would be that the specimens collected is in the correct order or labeled correctly. So it is important kasi so that each sample can be identified or tracked easily since hindi lang naman yun yung sample na itinetest sa lab, di ba? So there are a lot of samples. So for instance, if multiple samples, kailangan sa first sample should be labeled labeled A, for example, or the second sample should be labeled B, and so on and so forth. So next would be the correct anticoagulants or other additives used. So since different specimens require different anticoagulants or other additives to ensure that the sample is not degraded. So for instance, for our blood sample, this might require EDTA or heparin to prevent clotting, while urine sample may require boric acid or sodium fluoride to prevent bacterial growth. So next would be our specimens must be properly mixed by inversion if required. So di ba nabanggit natin kanina yung inversion ng hematocrit tubes 8 times. So that way that would ensure that all of the components of the sample are evenly distributed. So this can be done by gently inverting the specimen tube 15 to 10 times. So that depends on the tube or the test that is being required. So next would be that the specimens are not hemolyzed. So when we say hemolysis, this is the breakdown of red blood cells. So hemolysis can occur if the specimen is handled improperly or if the patient was not adequately prepared for the draw. So it is important to ensure that the specimen is not hemolyzed in order to ensure accurate results. So next would be that the specimen requiring patient fasting collected in a timely manner. For some tests kasi guys, di ba, it is important that the patient has fasted for a certain amount of time before specimen is collected. So for example, meron tayong test na tinatawag na fasting blood glucose test and as well as the fasting lipid profile. So both of which nagre-require siya ng at least 8 hours before the blood test. So kailangan mag-fast yung pasyente ng 8 hours before the test. And then as well as we also have that time the specimen are drawn at the correct time. So meron din kasi tayong mga test na nag-require lang during that specific time period. So, kunyari, in the morning or kapag certain hormone is at its peak, so doong part lang ng time na nakakollect. So, it is timed specimen. So, what happens naman kapag itong mga requirements na to is hindi na-meet? So, kapag hindi na-meet tong mga requirements na to, the specimen would be rejected. So, here are the following reasons. First would be that the test order requisition and the tube identification do not match. match. So this occurs when the order, sheath, and the specimen label don't match. So this usually due to an error in entering or writing the patient or specimen information. For example, ang apelyido ni patient is Smith, then yung nasulat mo is Snoth. So doon pa lang mali na yung specimen. So that would be rejected. And next would be that tube is unlabeled or the labeling including the patient identification number is incorrect. So paulit-ulit natin sinasabi yung patient identification must be properly done. So next would be the specimen is hemolyzed. So kapag some specimen kasi requires that some test requires that the sample should be free from red blood cells. So hindi dapat siya contaminated with red blood cells which nag-occur siya kapag hemolyzed yung specimen. So dito, kapag hemolyzed yung specimen, mare-reject siya. Next would be the specimen was collected at the wrong time. So yun nga, di ba, one of our requirements is that for type specimen, dapat na-collect siya within that time period na required. So next is that the specimen was clotted and that the test request requires whole blood or plasma. So this occurs when the specimen has clotted and the test requires a sample that is in liquid form. For example, the blood sample is not for a test that requires is sent for a test that requires a serum sample, and then yung sample is clotted. So that sample now would be rejected. And then we also have that the sample was contaminated with intravenous fluid. So for example, using urine sample is sent for a test, and then that sample is contaminated na siya ng intravenous fluid, then that sample would also be rejected. And last would be that the sample is lipemic. When I say lipemic, that is contaminated naman with lipids. So yung lipid na yon kasi it could interfere with other test results that is required to perform. So for example, yung meron kang serum sample for test, and then yung sample na yon is lipemic, then your sample specimen would be rejected as well. Ayan. So I hope you have listened to my discussion because we will be having a short game again. This is entitled Reject or Accept. So first, in this game, guys, you will be answering whether the specimen pictured is to be rejected or accepted. So what do you think would be the first one? Oh yes, Miss Zhyra.
I reject because it is hemolyzed.
Yes, so nakikita natin yung red part sa taas. Yung nagkaroon ng hemolysis. So that sample would be rejected. Next. Would that be rejected or accepted? Yes, Suzea. Oh, yes.
Sir, accept po.
Oh, that would be accepted. Let's check. Yes, it would be accepted since the specimen is properly labeled. How about this one? Yes, Miss Jada.
Sir, reject po. Kasi
Oh.
we can't read the text.
Yes, I agree with that. Oh, so the correct answer would be rejected since the patient identification or what was written could be hardly read. Next, let's move on with blood typing.
Okay, so ito na yung last na i-discuss natin for today, blood typing. So at this juncture, parang nasa application na tayo ng capillary puncture. So what is blood typing? Blood typing is a method to determine the type of blood an individual has. It is done to ensure the safety of donating an individual's blood or receiving a blood transfusion. So guys, may tanong ako. So bakit before mag-transfuse tayo ng blood, bakit kailangan muna natin i-determine kung anong blood type ng patient natin? Why do you think so? Okay, for an instance, kunwari, patients sa ER, diba? So, meron siyang severe blood loss. So, bakit kahit naghihingalo na yung patient natin, kailangan pa rin natin malaman muna yung kung anong blood type niya. Bakit kaya? Anyone? Zhyra.
Sir, ano po? Diane po.
Ayun, Diane. I'm sorry.
Sir, to ensure po compatibility po. To ensure safety of donating the blood or receiving blood for transfusion.
Okay, so tama si Diane. Aside from that, guys, kasi kapag incompatible yung na-transfuse sa'yo na blood, ang mangyari kasi guys is magkakaroon ng acute hemolytic reaction. So after dun, magkakaroon ng coagulation of blood, kaya magkakaroon ng, or possibly magkakaroon ng death. Okay? So it is also done to verify an individual if an individual has RH factor on the surface of his or her red blood cells. So guys, ano ba yung RH factor? So yung RH factor yung tinatawag natin, ito yung parang positive or negative na sinasabi nila after ng blood type natin. So for example, AB positive. So yung positive is the RH factor. Ibig sabihin RH positive siya. So blood is often grouped according to the ABO blood grouping system, which is based on the presence or absence of certain markers on the surface of red blood cells. So guys, review lang ng past lesson natin. Sinong nakadiscover ng ABO blood grouping system? Anyone?
Sir, ako, sir.
Ayan, Zhyra.
Sir, si Carl Landsteiner.
Ayun, tama. So si Carl Landsteiner ang nakadiscover ng ABO blood grouping system. Next slide. Ayan, so let's take a look naman in this data table or blood group system table. So blood type A, ang antigen na present sa kanya is A. So ang antibodies na present sa kanya is anti-B. So guys, ito na yung reason kung bakit, for example, ako is isang type A, and then yung magta-transfuse sa akin is type B, incompatible kami. Why? Because yung blood ko, meron akong anti-B na antibody. So yung anti-B ko is i-attack niya yung type B na madodonate sa akin. So again, magkakaroon ulit ng acute hemolytic reaction and magkakaroon ng DIC and magiging magko-coagulate yung blood namin and magkakos ng death ko, if ever. Okay, so blood type B, ang antigen is B and then antibody is anti-B. Then type AB, ang merong antigen sa kanya is type A and B. So ito yung reason kung bakit ang type AB is ang ating universal. Type AB ang ating universal. Anyone? Okay, so ang type AB natin is ating universal recipient. So neither anti-A or nor anti-B ang present sa kanya. And lastly, we have type O blood, neither antigen present, and antibodies anti-A and anti-B. So kung ang type AB natin ay ang ating universal recipient, ang type O natin ay ang ating universal
Donor, sir.
Tama, donor. So other than this, there is a third kind of antigen called the RH factor. So based on the presence or absence of this antigen, the 4 blood groups are classified into 8 different blood types. Next slide. So these are now your presence of RH positive, A positive, B positive, AB positive, O positive, and presence of RH negative naman, A negative, B negative, AB negative, and O negative. Next slide. Ayan, blood typing equipment. Next slide. So first, of course, kailangan natin ng blood sample natin because yun yung ating tinetest. Next is anti-sera. Guys, para maalala natin, alalahanin natin na A stands for azul. So kung anong color blue, siya ang anti-A natin. And next is B stands for banana. And anong color ng banana? Is color yellow. So ang color yellow is ang anti-B. And obviously, kung ano natira is the anti-B and clear yung color niya. And then, we have toothpick. So, ginagamit natin siya kapag mag-mix tayo ng blood sample with the anti-Zhyra. Next slide. Next, we have glass slide. Doon natin nilalagay yung mga sample natin. We also have cotton balls. Yun yung ginagamit natin para ma-stop yung bleeding sa patient natin. Lancet, we use that to prick our patients. And lastly, sharp container. Doon tayo nag-dispose. Guys, kapag sharp container, we have to kailangan natin ma-remind sa sarili natin na ang sharp container, ang tinatapon lang dapat doon ay mga sharp objects, okay? Kapag any objects other than sharp objects, mayroon silang designated na bin or disposal bin or container. Next slide. Ayan, blood typing procedure. First is to prepare a clean glass slide and draw 3 circles on it. So guys, hindi naman natin kailangan need na mag-draw talaga ng 3 circles. So pwedeng parang mentally na lang natin imagine na kailangan yung mga samples natin is or yung 3 drops dapat magkakahiwalay. May ample spaces in between. Kailangan kasi na guys na may space in between para hindi ma-contaminate yung yung kunwari isang blood, hindi siya mag-join or mag-mix sa pangalawang drop of blood. Something like that. Okay? So next is get the anti-Zhyra, drop every anti-Zhyra on the respective circles. Guys, hindi ba i-drop yung tatlong anti-Zhyra sa isang drop of blood, okay? So, kunwari anti-Zhyra is dun sa first drop of blood, second drop of blood is the anti-B, and then the third drop of blood is for anti-B. Next is to keep the slides aside safely without disturbing. Fourth is to sanitize the fingertip where the blood sample will be collected. Next is to prick the clean fingertip with the lancet. Wipe away the first drop of blood. So ayan guys, kailangan ulit natin i-wipe away yung first drop of blood because possibly contaminated na siya with alcohol or other interstitial fluids. Next is to allow the blood to drip onto the 3 glass slide circles. Stop the blood flow by applying pressure to the prick areas. So guys, andyan na naman tayo sa apply pressure. Okay? So apply pressure para mag-initiate yung clotting process. Next is to gently mix the blood samples using a toothpick. And lastly, look for agglutination. Next slide. Okay, so blood typing precautions. After using the cotton balls, toothpick, lancet, and alcohol swabs, throw them away immediately. After observing the outcome, place all the components, including the glass slide, into the biohazard disposal container. So guys, it's all about this disposal kasi kailangan natin napapollow yun. Next slide. Okay, so mag-analyze na tayo ng blood sample. So, if agglutination is present in the first circle with anti-A, anti-Zhyra, color blue, then the blood group has an A antigen. By the way guys, ano ba ibig sabihin ng agglutination? Ang agglutination guys is parang siyang clump, nagka-clump yung blood natin. So parang itsura niya is parang may batik-batik, parang ganun yung itsura niya. So if an agglutination is present in the second circle with anti-B, anti-Zhyra, color yellow, then the blood group has B antigen. And if agglutination is present in the third circle with anti-B, anti-Zhyra, no color, then the blood group is Rh positive. Next slide. Okay guys, so may palaro lang tayo para mag-practice tayo sa pag-analyze. Ma-practice tayo sa pag-analyze ng blood sample or blood type. So guys, nag-agglutinate yung unang drop of circle, so mayroong agglutination sa anti-A, nag-hemolyze yung anti-B, and then mayroong agglutination sa anti-D. So ano kayong blood type yan guys?
Sir, A positive po.
Okay, tama si Diane, A positive. Guys, again, ang pagbisa natin kung positive is yung agglutination, okay? Okay, how about that?
Sir, O positive po.
Okay, tama. Kasi ang nag-agglutinate lang ay yung anti-D. Okay, so anong blood type?
positive.
Yes?
E positive, sir. Rar.
Ayan, tama. O, ano naman yan? Nag-agglutinate lahat. Ano kaya yan?
Sir, AB positive po.
Yun, tama. AB positive. Oh, I think yun na lahat ng ating kailangang i-discuss for today. So before tayo mag-end guys, parang may isi-send lang kami mga teachers nyo sa GC na lang natin ng parang post test natin. Guys, short lang yun, mga 20 items lang yun. So mga tanong about to is yung mga na-discuss natin for the entire lecture. Okay guys, I think that's all. May dadagdag pa ba kayo, Prof. Junel and Prof. Zoren?
Oh yes, class, we will be meeting next week for our practicals as well. We will be applying what we have learned here. So gagawin natin yung capillary puncture, and then for that, we will be having your blood type as well. How about you, Prof. Junel?
Wala naman na since na-discuss naman na natin lahat.
Okay then.
Ay, documentation daw, sabi ni Suzea.
Okay, documentation.
Document.
I would take the photo ops. Okay, Miss Diane na lang. Then, okay. Take a picture.
Ako po yung mag-take ng picture po. Wait lang. 1, 2, 3. Isa pa po. 1, 2, 3. Okay na po.
Okay, that would be all, class. Thank you again for listening, and
Thank you, sir. Thank you po,
have a
Doc.
good night.
Good night
Thank you
po.
guys. Aral
Thank you,
well.
profs.
Thank you po mga teachers.